Hello everyone, this is group 18. We are going to present to you for the Novamax Plus ketone test strips. Our group is Megan Jane, Crystal Gale, Glenn Burton, Blair Andriasi, and Jimmy Assisi. These are the lecture objectives for the presentation. We're going to talk about the Novamax Plus ketone testing kit and what's included in that package. We'll discuss the Novamax Plus ketone test strips and what they're actually testing. We're going to cover the cost, features, and ease of use, as well as go over how to actually use the test strips. And then we're going to talk about the results and specifically what those results mean. For the ketone test strips, they are testing the ketones in the blood. What does that mean? When the body, specifically the cells, do not receive the sugar needed, the cells will begin to burn fat. It's this burning of fat that creates the release of ketones, which make the blood more acidic. Specifically for type 1 diabetics, this can be a warning sign that diabetes is out of control. These are the symptoms of high ketones in the blood, which can also be called ketoacidosis. The early symptoms include thirst or very dry mouth, frequent urination, and high blood sugar levels. Later symptoms are a constant tired feeling, as well as nausea, vomiting, or abdominal pain. So this slide is going over when somebody should test their ketones. The list here actually comes from the American Diabetic Association. So some of these are going to actually entail a little bit more focused on diabetic patients, but generally that's the people who are going to be testing for their ketones. So the first couple of them, if you notice, are very similar to the symptoms slide, such as high blood glucose, thirst, dry mouth, tired feeling, nausea, vomiting, abdominal pain. However, for this, they do give a specific level for the blood glucose when it's above 300 milligrams per deciliter. But there are also some other times where somebody should be testing as well, such as when they're sick from the cold or flu, they have flushed skin, hard time breathing, confusion or foggy feeling. One of the big standout ones is the fruity smelling breath. That's actually a really big indicator that somebody should test their ketones. Included in the Novamax Plus diabetic monitoring kit was the Novamax blood glucose monitor, the Nova SureFlex lancing device, and Nova normal control solution. The meter is obviously the meter used to test either the sugar or the ketones. The lancing device is used to puncture the finger with a lancet, and then the Nova normal control solution is actually used to help recalibrate it if need be. You also get 10 lancets in the kit, 60 Novamax glucose test strips, and 10 ketone test strips. Along with that, it also has a guide for the meter, logbook to record the results, and a carrying case for on the go. The one big advantage with this meter is that the meter does actually test both the blood sugar and the ketones, just depending on which test strip you insert. So now we'll go over the pricing and availability. We got all the prices and all these images from TotalDiabetesSupply.com. The monitoring kit combo came with the monitor test strips for both the blood sugar and ketones, and that was $37.17. The Novamax blood glucose meter just itself was $14.99, and then a box of 10 test strips was $17.29. There were varying prices online. Most of them, however, were between $17 and $20 with a couple of outliers, but that was the general price of the box of 10 test strips. So to use the monitor, what you'll do is you'll insert the ketone test strip into the monitor. It'll then display everything for 2 seconds, and then after that, one more second later, it'll show a blinking blood drop and the word KET. That'll let you know that you inserted a ketone test strip. You'll wash your hands with soap and warm water. You can also use an alcohol pad, either or, and then you'll dry thoroughly after cleaning. You're then going to just hold your hand down slightly and massage the finger downward towards the tip using your thumb. That's just to help to stimulate some blood flow to the area. Then you'll use the lancing device. You'll insert a new lancet into there. You're never to reuse the lancet, and you'll puncture the finger and then squeeze just a little bit with your fingers to form a drop of blood. So now that you have a drop of blood, you'll use the test strip to get a drop of the blood, and you'll wait for the countdown timer to begin. It'll count down from 10 seconds. If there's beeper sounds enabled, you'll also hear a beep. And then after the 10 seconds, your result will display automatically and get stored into memory. The meter does allow you to press left and right buttons to mark or unmark the results. This is so that if you're doing any control testing, anything like that, it doesn't get included into your running average. Then when you're done, you press mode, and that'll save that marking status so you don't have any issues with that. And then if there's any extremes, so if you're above 8 on the reading, it'll actually display high, HI, or if you're really low, below 0.1, it'll display LO for low. So the Novamax Plus ketone test monitor works very much just like a regular glucose monitor. So on the left, you'll see the picture with the lancet where you would puncture the finger. Then in the center picture, you're going to see the meter with the test strip where you're drawing the blood into the test strip. And on the right, you'll see it displaying the result. So this slide goes over how to read the results according to the owner's guide. If you're below a 0.1, this is going to display low on the monitor. That means there's no action required. If it's 0.6 to 1.5, that means you should recheck your blood glucose. If you get above a 1.5, it recommends you contact your primary care doctor. And then if you get above an 8, it's going to display the word high. And in that case, they want you to retest and contact your primary care. So in using other guidelines, such as the National Health Services of the United Kingdom or the University of Colorado Denver, they have matching guidelines where they're substantially different from the manual. If you get 0.6 or below, then you're going to want to that's normal. If you get a 0.6 to 1.5, it means your ketones are slightly elevated, and they do recommend a test again in a couple of hours. Here's where it really starts to vary. If you get above a 1.5 to a 3.0, they consider that moderately elevated, and they want you to contact either your primary doctor or your diabetic manager. They definitely want you to contact someone. However, if you get above a 3, both guidelines recommend you seek medical help right away. So there's a big difference between the 3 on the guidelines here versus the 8 in the manufacturers. And these are the references that were used during the presentation. And now that you all know that the ketones are possibly coming, we just want to know, what questions do you have?